Hi, I'm Dr. Alex Fibishenko, and I'm going to talk about 4 of the most common materials we use for final teeth in full arch replacement. One of the features of All-on-4 Plus is the fitting of immediate final teeth, which means that your fixed final teeth are fitted within 1 to 7 days from your implant surgery. What makes the teeth final is the titanium frame which supports the prosthetic teeth that are fitted on top. The type of teeth used on top of the titanium frame will depend on your individual circumstances and your dentist's recommendation. An important thing to consider is that every material has certain limitations, be it in relation to the aesthetics, comfort, its physical strength, or its biocompatibility and potential impacts on the implants. Hand-set acrylic teeth. The teeth are hand-set on top of a custom-milled titanium frame, and the shape and thickness of the gums are hand-contoured, making them highly aesthetic and comfortable. They're also simple to adjust or reline, even in case of unlikely shrinkage of the gums, and have the ability to act as a shock absorber to reduce the impact on the supporting implants. The main limitation is only its physical strength. In 1 out of 6 patients, the improvements in the forces of the bite from the treatment may be beyond the tolerance of the acrylic material, and it can break even within 5 years. If this happens, we need to address the cause, being the biting pressures, by, for example, using anti-clenching injections during your cleans maintenance visits, or sometimes we may recommend using a protective mouthguard to wear during sleep. If we are unable to control the cause of the breakages with these kinds of simple measures, then changing the teeth over to a stronger material may be the only effective long-term solution. You may change to one of the other 3 options I will talk about. Milled acrylic, PMMA. PMMA is an acrylic material where the entire bridge is milled from one block instead of being hand-set and processed like the first option. Since all the teeth in the arch are connected, the main advantage over hand-set individual acrylic teeth is an improved in the physical strength of the bridge, and the breakage rate reduces to less than 10%. PMMA is made using a fully digital design and fabrication process. They tend to be slightly less alive aesthetically. They're not as simple to adjust or repair, and they may be slightly bulkier compared to the hand-set high-impact acrylic teeth, but they're still lighter in weight than the next 2 options. There is no cost difference to the hand-set acrylic teeth. Ambarino. It is hybrid glass ceramic with a flexibility which has a shock-absorbing effect on chewing pressure. It is initially milled from a block, and the gums and teeth are then further crafted by hand, which gives it an outstanding aesthetic and comfort. It takes more time to produce, but can still be used as immediate final teeth at a 7-day turnaround, during which time the template teeth are worn. There is a cost difference of $2,500 compared to PMMA or hand-set acrylic teeth on top of All-on-4 Plus treatment cost. Zirconia. Zirconia is the strongest tooth color material available for any kind of dental restoration. It has a long track record in dentistry, as it has been used for many kinds of applications. The material is milled and sintered and is very dense, and it is more stable over time and less likely to stain or break. All this sounds great, but due to its density, it is also very heavy and rigid, which means that it is less able to absorb impacts from the bite and function. These impacts are instead transmitted to the implant interface, which may result in other issues such as screw or abutment loosening, and may even lead to bone loss around implants. There is also a typical clicking noise when the teeth meet. If you ask me, having done many different kinds of restorations, my personal overall favorite is hand-set acrylic, primarily because of its aesthetics, repairability, comfort, lightness. The physical properties of acrylic or PMMA make them ideal for absorbing some of the impacts from your bite, which is especially important during the initial healing and osseointegration of the implants, but also over time. Ambarino is a relatively new material, so the long-term outcomes are less well known. From our experience to date, it may be slightly more susceptible to staining than all the other options, and it may not be as resistant to breakages as we initially thought it might be. We strongly advise against using zirconia as immediate final teeth. We reserve this option only for patients who need it in the future due to an excessively heavy bite, along with pressure-reducing remedies. We may need to regularly use anti-clenching injections or night guards, or we may even need to regularly change components in the upkeep over time. Should you ever wish to change the teeth or need to upgrade to a stronger material, this can be easily done and will always be offered to you at our bottom rates under our replacement and upgrade pricing guarantee. This is part of our ongoing commitment to your ultimate satisfaction and long-term care. Thank you for tuning in. Always remember, happiness begins with a smile.